8th edition of the Annual General Meeting and Scientific Conference of the Association of Nigerian Private Medical Practitioners ANPMP Lagos Chapter was held on the 10th and 11th September 2025, themed Building Resilient Private Healthcare Systems in Lagos State, a driver of public-private collaboration, economic stability, and good governance. The event featured lectures, exhibition, and other brainstorming sessions. Speaking at the conference, the chairman of ANPMP Lagos Chapter, Dr. Jonathan Esegine, highlighted the widening gap in healthcare delivery in Nigeria. He identified critical challenges such as poverty, inflation, inadequate infrastructure, and limited access to essential health services.
It has also brought to the fore the numerous challenges which are undeniably here with us, e.g., our exploding population, growing poverty rates, hyperinflation, grossly inadequate infrastructures, especially lack of energy, cost of care, affordability, especially to the vulnerable members of our society who are clearly the majority. This is where the members of this association have filled and continuously filled the gap, providing accessible, affordable, and always available primary and even secondary care because of our presence everywhere, urban, semi-urban, rural areas, even at enormous cost to individual facilities. This most unfavorable environment, the Nigerian private medical practitioners has carried on stoically, preserving, promoting, and defending the health of the people, mostly at the grassroots. This makes this year's conference theme, Building Resilient Private Health System in Lagos, a driver of public-private collaboration, economic stability, and good governance, very apt. And with the well-appointed speakers and panelists, I am confident that the issue will be significantly addressed with appropriate recommendations to appropriate authorities.
Notably, private medical practitioners cater to 65% of patients in Nigeria, underscoring the need for stronger collaboration with government to meet the nation's healthcare demands. This was reinforced in a thought-provoking keynote lecture delivered by Professor Dr. Francis Adedayo Faduyile, former Nigerian Medical Association president, who emphasized advocacy for government recognition of the vital contributions of private medical practitioners.
There is also a need to interact with government and private practitioners to encourage horizontal referral as against medical tourism that bleed our country. Some of the private facilities have and properly maintained equipment that are needed and used in these medical tourist nations. A proper PPP arrangement can be made to bring in those equipment in such facility to use in Nigeria. The public medical practitioners can also interact with these centers to improve their knowledge and expertise. We should always put it in mind that almost all medical tourist health institutions, either wherever, in UK, in India, anywhere, are privately owned. Most of them. So what stops us? Hence, we need to develop our own. It's a clarion call to all of us here. We need to support reverse migration of highly skilled medical practitioners by providing an enabling environment in our private institutions to support the collaboration. Many of our people outside the country are willing to come home. The federal government, the state government cannot take care of what they need. The private practitioners can do that. Let us give them that opportunity. Improve your practice, give them room to be able to work, and let people know. I think when you have that, it's a good collaboration that you do with the government.
Other participants and stakeholders also stressed the need for robust public-private collaboration.
The problem between the private practitioners and the government has been a lot of government policies that are anti-private practice. If we are not being confrontational, then we have to find a middle course to sit down with the government or their agencies and negotiate ways forward. We are putting everything in place in our practices to make sure that we provide the best to complement what government is offering.
We need to come with more figures. We need to come with data and let government know these are the challenges, and you want us to do this, you want us to do that. This cost we cannot put on patients, because if we want to put the total cost of what it takes in the private sector, an average Nigerian will not have access to health care. So more or less the private sector is doing quite a lot of social services.
We are saying government needs to give desired recognition to private sector participation in healthcare delivery. And we need encouragement. There are so many challenges. We have named so many of them, a plethora of them. So we need that support. Like offering of loan, single-digit loan, will go a long way to promote private participation in healthcare delivery.
The need for collaboration cannot just be overemphasized. What is important is to ensure that the government is on the table to do the regulation, because at the end of the day, the government is funding it. The government is creating a regulatory framework to it. So it will eventually enhance and improve on the statistics.
The conference highlighted new strategies for partnering with the government for sustainable healthcare.
We need to find a way so that the public-private will know that we are serving the same set of people, the patients, who are supposed to be taken care of by the government as it is. That's the primary thing. In the Constitution, the Constitution says that the government should, as part of its duty, to ensure that we have proper health for the people. And that's why we have the National Health Act. But importantly, we need to now change the tactics of how things are. And I think that is what we have discussed here. For the private people now to be a driver of getting the government to do the needful, so that we will now understand that there is more than enough need now for us to have that partnership, so that we can now assess after a while.
Overall, the annual general meeting served as a platform to deliberate on best practices to deepen collaboration between government and private medical practitioners, with the goal of strengthening Nigeria's healthcare system.